Thank you for coming, Rachel.
My pleasure.
Rachel, you recently said that NCDs have grown to be the century's defining health and development challenge on our watch. You said our generation's responsibility is to respond sensibly and creatively to the NCD crisis in line with the scale of the problem. Those are big words. What have you seen recently that leads you to think that this challenge may or may not be met?
Well, we're seeing a combination of changes in the epidemiological environment, that is, what people are experiencing in diseases and how it's affecting their lives, making them sick and for how long. And we're also seeing, of course, demographic change. So that combination is pushing us quite rapidly towards populations, even in poorer countries, that are going to be sick for a long time and that are going to be expensive in those countries and less productive. And so that combination is a very dramatic one if we don't respond to it. And the reason I think it's important for our generation is, we have solutions, we have tools in hand, but we've been sort of sitting by and watching this roll out. Margaret Chan, the Director General of WHO, has called it a silent epidemic. And there's no excuse for that. We can do better.
That's a great point. When you say we can do better, what role can the private sector play? Or what tools do they have that you could utilize and Margaret Chan could utilize?
Yes, well, first of all, we can't do it without the private sector, so that's the place that we start. The private sector has all kinds of capital that is needed to address this problem. And I don't mean just financial capital, that's important, but maybe even more important is human capital, intellectual capital, and social capital. So how can we work together, both public and private sector? And the public sector has a big responsibility here too. The private sector can join with the public sector for the social goals, for some kind of shared value goals. At the same time, there are growing communities of people in developing countries that can pay for their care, that can afford it, that want high quality care, that are going to live a long time. We don't want them to be paying for bad care. We don't want people to become impoverished because of trying to get health care. So the private sector can provide good quality services, sometimes hand in hand with the public sector, sometimes on their own. And there are all kinds of ways that they can do it. You asked me about tools, for instance. One of the things that we lack a lot in these countries in regard to this problem is just good information. So, what kind of information improvements, what kind of improvements in the information environment can we do? We're working on how to use mobile devices to gather information about risk factors for NCDs. And we can do that a lot quicker and more cheaply than we can do large population surveys. So if we can get good information that way, and the private sector produces these tools, makes them usable in low resource settings, analyzes the data, applies it to what the needs are, then that's a role for the private sector to play. If we can do that kind of stuff, we can vastly improve our ability to respond because we have better information.
Great. As you know, with our fund, data is at the heart of what we are doing, and we hope to provide the big data analytics for the populations we serve to be able to give outcomes at the right cost to governments. But I don't know how governments are responding at the provider end. There's one thing having the data, but how do you then expand the provision to the population?
Yeah, it's a good question, and I guess I would first say that governments aren't doing it right now in a lot of the countries that I'm concerned with. So they need some help. In some countries, they have used community health workers historically for delivering family planning, for delivering vaccines, etc. So we're certainly able to learn from that experience and bring those health workers on board with delivering some NCD care and treatment and management. And Ethiopia is doing that with its outreach workers, and Rwanda has specially trained NCD community health workers, and their training takes them 2 years to train a cadre of mental health community health workers to go out there and help with counseling. So when it comes to the continuum of care, we want to make sure that people don't get all their care in an expensive facility from specialists, because they're not even there. We want to get them to the community. We want to get them to their peer groups, to their peer support groups, to deal with some of these sort of behavior-driven problems. And we want to get some of that management of disease and health into the home. So that's something that is, I think, we can use the information spectrum to provide appropriate information in the right place for the system to help people manage their own conditions as well.
So to summarise, Rachel, I think we've said NCDs are a massive challenge and it's getting worse. Governments need to respond by working together with the private sector, working together with data, and we need to shift care back into the community, into homes. If we can get that right, we may have a chance of meeting the Sustainable Development Goals.
Yes, I would agree.
Thank you.